I think this leads into chronic illness, right? And,
Right.
again, what Daniel was saying, most of the experts we speak to saying that, we're seeing a massive rise of chronic illness, chronic inflammation, that wasn't in the past. And it's obviously introduced by these microplastics or this poor eating habits or the fertilizers, and I
Right.
know with like myself, I've had autoimmune disorders my whole life. When I switched over to a mostly vegan diet, um, it didn't cure everything, but it brought me to that 90% marker, right? But I still have about 10%. I've got a little bit of psoriasis in my arm. Sometimes my psoriatic arthritis bothers me. My colitis isn't always perfect. How do we, bridge that gap? You
Well, with
know,
you, I mean, you need to really take it to the next level. In other words, do you know your body fat percent, number one? And do you know your omega-3 index, number two? Because when you have a disease like psoriasis, you need a high omega-3 index with a low body fat. So you should at least know your numbers, you know?
okay.
So like, so what is your body fat? Do you know?
It's somewhere under 10%, you know?
Really?
Yeah, yeah.
That's excellent. All
So,
right.
yeah, I
And
know I'm not bad. I'm 5'8". I'm 128 pounds, so, I'm pretty lean in that sense.
great. And
Yeah.
so
I don't
and
know
do
what
you
my
know,
omega is though, but I will test that for sure.
okay, test your omega-3 index. That would be the next step. So you're on the right track then. It's a healthy diet because we generally, let me give you an example. A person has like lingering psoriasis. We put them on a fast and their psoriasis goes away. But if we refeed them and they start to gain weight back too much and eat too much food, their psoriasis starts to come back a little bit again. They have to be in that
Mm.
range. They have to eat so healthfully, but they have to make sure they don't overeat and get enough sleep because obviously even overeating a little bit can help their immune system be a little too excessive. And the excessive supplying of the immune function, you know, and also, of course, so we're talking here about a tendency for autoimmune patients. So most of our people with autoimmune disease make complete recoveries using these same basic principles for long life.
How long of a fast are you talking about? What does that look like?
Probably a water fast of 1 week would clear your psoriasis. But then the question is, what's the right diet to stick to after the fast so it doesn't come back again? You know what I mean?
Hmm.
And that's why sometimes there's certain, and as you know, there's certain foods that can be more immunostimulating, like gluten or dairy products. There are sometimes people that can't eat certain foods. Even quinoa can be stimulating to immunostimulating for some people because there's saponins in there. So sometimes we have to make modifications to the diet. For example, people with Crohn's disease can't eat nutritional yeast, and they can't eat quinoa, and people with lupus can't eat alfalfa sprouts. So sometimes there's some further modifications we can make for these individuals who need their diet to be a little bit restricted.
Now, in regards to that, do you think there's anything still trapped in my body that needs to be like pulled out, like with through chelation or anything like that?
No, I don't.
Interesting. Well, Daniel, you're up
Mm.
next.
Yeah, okay. Thanks for putting on your clinician hat, by the way. This is fun.
Yeah.
So I've been, suffering with autoimmune disease most of my life. Very severe eczema, chronic fatigue, narcoleptic, brain fog, very low energy. Anytime I would exercise, I would get sick the next day. It's just, and it still happens to me actually. We were just in Vegas for a week and we were walking 10 miles a day. And then for whatever reason, I start to get sick and then,
Mm.
and inflamed. I myself have diagnosed it as the root cause, as I'm curious your thoughts, as mercury toxicity. I recently discovered an amalgam filling. And after I got it removed, my symptoms started getting better. I started doing chelation therapy, a lot of green smoothies, which I've heard, the kale can pull out a lot of these heavy metals, wild blueberries, for example. Um, and I think I'm still not quite there yet. I still have brain fog. A lot of these like symptoms of heavy metal poisoning, like tics and anxiety. I'm looking to get to that next level. I've been vegan now for about 3, 4 years. A pretty clean diet. I do my best to be really clean. I think I'm really like very, very strict. Probably the strictest person I know, and Alex can vouch to this. I don't touch gluten. Don't touch, I don't touch wheat at all. So yeah, I'm just curious, like what I can do next. Or I just
Well,
continue on this path?
yeah, we all have our genetic weaknesses and things and our susceptibilities. Um, I would be interested in knowing your omega-3 index and what type of omega-3 fatty acids you are taking. to make sure that's a component. I
Yeah.
think that definitely the diet's going to help, but also I'd want to make sure you take a little zinc every day too, because your immune system. Because some people don't absorb zinc well, and just like some people, they're eating diet, they wouldn't think of taking iron, they wouldn't need to take iron, but there's some people who don't absorb iron well, and their ferritins are low, and people who have a tendency to burn out from exercise, and they often don't absorb zinc very well. So I definitely look at your zinc. Maybe I would take just a small amount of zinc each day, like 15 milligrams of zinc a day in addition to your regular intake. And then, and of course, the idea of, most people that have a lot of mercury in the system are people eating a lot of seafood, but you haven't eaten seafood in 10 years, right? Just you're saying you had teeth?
No, in like 3-4 years. Although most of my life I ate a ton of sushi and tuna, and there's one point where I think for a couple of weeks I was only eating tuna because I was on some stupid keto diet. Yeah, so I'm sure I have a lot of buildup.
Yeah, so with time that'll lower, but I do think in a case like yours, maybe doing some fasting might be useful too. If you're doing everything right, and your intake of nutrients are good, and your omega-3 index is good, and your zinc intake is adequate, then probably doing maybe a couple of fasts where you fast maybe 5 or 6 days, go back to eating healthy again. 8 months, 6 months, 8 months later, do another one, and then over a year, do 2 or 3 of those 5 or 6 day fasts. Build your muscle back again. You may accelerate the kind of like rejuvenation of cells, replacement of cells, and helping I don't want to fast you till you lose all your muscle mass, fast you for 21 days, 10 days max, because you're going to lose a lot of muscle mass. You want to be able to build that muscle mass back and keep your body fat low. But certainly, how are you sleeping at night?
I can sleep a lot. There's times where I'll sleep 13 hours. And I think I have very, very low quality sleep because I don't know if you can hear, I'm very congested, and I have been for most of my life. And when I sleep, it therefore causes snoring, apnea. People tell me that I choke and I stop breathing when I'm sleeping. So I think there's some sort of chronic inflammation going on here that affects my sleep.
Right. So if I could, I would probably add to my recommendations to you if you could afford it, to get a hyperbaric chamber and do the home hyperbaric for like a half an hour every day too.
Okay.
To help with oxygenation of your brain and things, you know what I mean? Because if you're getting too tired out from exercise, and of course exercise every day, but not to the point where you get exhausted. You know what I mean? Do it, exercise yourself with a scientific dose where you really feel some training effect, but not so exhausted the next day. So you maybe cut back on the amount you do, but still do something every day. Even if it's a minute, you know what I mean? Figure out what you can do that's safe for you each day.
Yeah.
And then do a little bit of hyperbaric.
Okay.
And you know what I also might do with you? Might also, just because of your these tendencies, I have a product called Ultracell Biotech, which has black turmeric and the curcumins and the sirtuins from green teas and astragalus. You've probably heard about these things. You're probably doing it, where you're taking these things that help the body, kind of like the cellular detoxicants, those things, and help the cells. And then the one last thing is you can get elemental magnesium that you drop into a glass of water, into purified water, that makes the water full of hydrogen. Because when you get these hydrogen water machines, they don't put much hydrogen in the water. They're kind of a waste of money. Because you buy these big machines that cost $1,000 to put a little bit of hydrogen that just fuses out of the water, and you're hardly getting any hydrogen. But if you take these special type of hydrogen tablets that you can get, that can made of elemental magnesium, you drop them in the water and they fizz like they fizz the water full of hydrogen, and you drink it down. Within a minute of the fizz, you can get a little hydrogen in your digestive tract, which can help you heal and get you to absorb nutrients a little better.